Hello everyone, and welcome to the final audio podcast in this series, the LabTronix series, as part of the Ballistix Edition. This is an RPSG and KDOS collaborative as part of a Storm Robotics production, and this audio podcast will surround around wellness and well-being. And once again, this is the Shientist. So to begin with, the incidence of CKD can lead to an individual's or patient's dependence on others, low self-esteem, and feelings of loneliness, and it can also affect the social mental aspect of the individual's quality of life. Well-being is something greater than not being sick or ill. For example, it is defined as having logic, independence, and also self-confidence. So, well-being and a sort of renal replacement therapy, or RRT, transplantation and RRT are known to be a sort of life-saving treatments, but they are also demanding and have an impact on everyday life of those who are under the category of end-stage renal disease, and negatively affecting emotional and psychosocial well-being. And transplant patients experience many stresses, such as time on different forms of renal replacement therapy, and also where there can be loss of intimacy, altered body image, and decreased physical and cognitive functions. More than a third of renal replacement therapy patients have experienced emotional difficulties during the transition of different forms of renal replacement therapy. And there's works by Taylor and team that have documented and evidenced works around this, and the full citation is at the bottom of well-being, and also in line to sort of well-being and renal replacement therapy. One of the effective factors surrounding well-being is stress. Renal replacement therapy can have negative effects of general health and well-being of those who are suspect or high risk for CKD or ESRD. RT can also have negative influence on physical performance, mental status, and social relationships as well. And RRT complications are not limited to physical and mental aspects, but also and of course economical. Slide. Um, and health professionals generally should seek to address for example, emotional issues during consultations, talking about emotional concerns and talking about sort of emotional concerns generally appears to improve patients' well-being. Untreated psychosocial problems are associated or can be associated with withdrawal from different forms of renal replacement therapy, poor medication and compliance or adherence, and also reduced ability to sort of interact in pre-renal replacement therapy sort of educational aspects in aligned to sort of treatment renal replacement therapy sort of treatment choices. So in and around quality of life, the quality of life of patients requiring different forms of renal replacement therapy is effectively significant and is associated with changes in sort of habits and lifestyle, and at the same time physical health, functional status, sort of relationships, and social and economic status are generally and greatly can be affected throughout. In and around sort of physical wellness, physical aspects of wellness, which includes having having a sort of having sort of a flexible having a flexible approach to different aspects, being sort of energetic and strong, having a strong being strong, or having a sense of strength in and around general well-being is important. And feeling well emotionally includes life aspects that pertain to life satisfaction and positive effects on life as well. Some of the stresses that can be part of this, however, include the following. So, undergoing routine renal replacement therapy sort of protocols and procedures, increase in psychosocial and socioeconomic challenges, financial disadvantages, social and marital relationships, routine hospital admission, challenge to take vacations or time out, restriction of leisure time, fear of disability or death or anxieties, increased dependence on different forms of renal replacement therapy, or otherwise sort of known as artificial renal machines or kidney machines, and limitations of where there's restrictions around sort of restrictions around sort of fluid, where there can be fluid restrictions or other sort of restrictions, and also where there can be physical or mental fatigue. And also in and around sort of self-esteem, patients with CKD can have difficulties in participating in sort of physical activities, as mentioned in one of the sort of previous audio podcasts in this series, but also in and around social activities, and this can have a negative effect on feeling of autonomy and self-esteem. And self-esteem and autonomy are basic of human in and around human psychological needs, contributing to daily well-being and psychological well-being as well. And once again, I want to say thank you for getting in on this audio podcast. This slide just highlights a few acknowledgements and where there's been again a sort of co-development surrounding this slide set from colleagues between an academic institution, the Renal Patient Support Group, the RPSG, and also the Kidney Disease and Renal Support Group, or KDARS for Kids. This has been an audio podcast in the LabTronix series, and it's been part of a Storm Ballistix production, and that closes this particular series, and hopefully we'll be looking to put out another audio podcast sort of series in due time after this. Thank you for tuning in, and hopefully the audios podcasts around this series around sort of nephrology practices and different aspects that surround nephrology have been helpful. Thank you.